Good morning, and before I say anything else, I need you to stop. Stop believing that cancer is something that just happens to you, something written in your genes that you have no control over. Because what I'm about to share with you today completely dismantles that myth. And honestly, it's something the conventional medical system rarely takes the time to tell you. My name is Dr. Sarah Mitchell. I'm a board-certified oncologist with over 22 years of clinical experience, and today I'm revealing the single most powerful daily habit that can dramatically reduce your cancer risk after the age of 50, and it costs you almost nothing. A landmark study published by the Harvard T.H. Chan School of Public Health followed over 120,000 adults for more than 26 years and found that people who consistently practice this one daily habit reduce their overall cancer mortality risk by up to 42%. 42%. That's not a supplement. That's not a drug. That's a lifestyle habit that most doctors spend less than 30 seconds mentioning at your annual checkup, if they mention it at all. And stay with me because the number one habit I'm going to reveal, that the most powerful one on this list, is something almost every person over 60 is getting completely wrong. In fact, the way most seniors do it actually increases their cancer risk. I'll explain exactly what that means and how to fix it. But first, and before we dive in, I want to ask you something personal. Drop your age in the comments below and tell me, do you currently have a daily health routine you stick to? I read every single comment on this channel, and your answers genuinely shape the content I create for you. This community matters deeply to me, so please take 2 seconds and let me know you're here. Now we're counting down from 5 to 1, ranked from highly effective to the single most impactful cancer-preventing daily habit you can build after 50. Let's begin. Coming in at number 5, and this one surprises almost everyone I share it with: sleep. Not just any sleep, but deep, consistent, high-quality sleep of 7 to 9 hours every single night. I know what you're thinking. Sleep is for recovery, not cancer prevention. But here's what the research actually tells us. Scientists at the University of Chicago found that adults who consistently slept fewer than 6 hours per night had significantly elevated levels of cortisol and inflammatory cytokines. Think of these as tiny fire starters circulating through your bloodstream. Chronic inflammation is now recognized as one of the primary drivers of cellular mutation, which is essentially the first step toward cancer development. After the age of 60, your body's natural melatonin production — melatonin is your sleep hormone, your body's internal clock manager — drops by nearly 50%. This matters enormously because melatonin isn't just helping you fall asleep. It's also one of your body's most potent antioxidants, actively repairing DNA damage that accumulates every single day. When you're not sleeping deeply, that repair process gets cut short night after night, year after year. I had a patient, Margaret, 71 years old, from Tucson, Arizona. She came to me after her second abnormal mammogram result, and when I reviewed her lifestyle, the first thing I noticed was that she was averaging 5 hours of broken sleep a night for years. We worked together on sleep hygiene: consistent bedtime, complete darkness, cooler room temperature, no screens after 8 p.m., and within 4 months, her inflammatory markers had dropped substantially, and her follow-up imaging showed measurable improvement. For practical steps: aim to be in bed by 10 p.m., keep your bedroom between 65 and 68 degrees Fahrenheit, and consider pairing your sleep routine with a small amount of tart cherry juice, which has been shown to naturally support melatonin production. Scientific references, as always, are linked in the description below. Number 4 on our list is something I call strategic hydration, and I want to emphasize the word strategic because simply drinking water isn't enough. A study from the National Cancer Institute found that proper daily hydration was associated with a 51% lower risk of bladder cancer, one of the most underreported cancers in adults over 65. Here's the biological reason this works. Your kidneys and bladder are constantly filtering waste and potential carcinogens, cancer-causing compounds, out of your body. The faster and more consistently you flush those compounds through, the less time they spend in contact with the delicate cellular lining of your urinary tract. The problem is that after the age of 70, your sense of thirst diminishes significantly. Your hypothalamus, and the part of your brain that regulates thirst signals, becomes less sensitive, meaning you can be severely dehydrated and not feel thirsty at all. This is not a character flaw. This is pure biology. The solution is scheduled hydration. Drink a full 16-ounce glass of water first thing in the morning, before coffee, before anything. This rehydrates your cells after 7 to 8 hours of breathing and perspiring overnight, and it jumpstarts your lymphatic system, your body's internal waste removal highway. Throughout the day, target at least 6 to 8 glasses total and pair your water with a squeeze of fresh lemon. The citric acid in lemon activates liver enzymes that help neutralize certain carcinogenic compounds, according to research from the Linus Pauling Institute at Oregon State University. I want to pause here for just a moment because if this video is already giving you information you've never heard from your own doctor, please take a second and hit that subscribe button and give this video a thumbs up. There are over 10,000 seniors on this channel getting this kind of research every single week, and I would love for you to be part of this community. The like button also tells YouTube to share this with more people who need to hear it. Okay, let's continue. Number 3 is something so ordinary you will almost dismiss it, and that would be a mistake. Daily sunlight exposure, specifically targeted morning sunlight for vitamin D synthesis. Let me tell you about Robert, 68 years old from Portland, Oregon. Robert came to me following a prostate cancer diagnosis caught in its early stages. His vitamin D levels were critically low, a reading of 14 nanograms per milliliter, when optimal cancer protective levels are between 60 and 80. He had spent years working indoors, avoiding the sun out of skin cancer fear. We corrected his vitamin D both through supplementation and deliberate morning sun exposure, and Robert is now 5 years cancer-free and an absolute evangelist for this habit. Here's the science. Vitamin D isn't really a vitamin, it's a hormone, one that directly regulates over 200 genes in your body, including several that control cell growth and program cell death, a process called apoptosis. When cancer cells begin forming, one of your body's primary defenses is to trigger apoptosis, essentially telling the rogue cell to self-destruct before it can replicate. Vitamin D is critical to that signaling process. Research from the University of California, San Diego found that women with vitamin D levels above 60 nanograms per milliliter had an 82% lower risk of breast cancer compared to those with levels under 20. After 65, your skin produces vitamin D from sunlight at roughly 40% the efficiency it did when you were 30. Another one of those biological realities nobody warns you about. This means you need both smart sun exposure and, for most seniors, supplementation. Aim for 15 to 20 minutes of morning sunlight before 10 a.m. on your arms and legs without sunscreen. Pair your vitamin D3 supplement, ideally between 2,000 and 4,000 IU daily, with vitamin K2 and a meal containing healthy fat. The fat is essential because vitamin D is fat soluble, meaning without it, your body absorbs almost none of what you take. Ask your doctor to test your levels at your next visit. Number 2, and this is the one that genuinely surprises people, the dramatic reduction of ultra-processed food and its replacement with a specific eating pattern I'll describe in detail. A 2023 study published in the journal eClinical Medicine, which is part of the Lancet group, analyzed data from over 200,000 participants and found that each 10% increase in ultra-processed food consumption was associated with a 6% increase in overall cancer risk and a 19% increase in ovarian cancer risk specifically. Now, I know that sounds abstract, so let me make it concrete. Ultra-processed foods, packaged snacks, deli meats, frozen meals, sodas, sweetened cereals contain compounds called advanced glycation end products, or AGEs. Think of AGEs like rust forming on the inside of your cells. They accelerate cellular aging, promote chronic inflammation, and directly damage your DNA over time. After 50, your body's antioxidant enzyme systems, the natural defenses that would normally neutralize some of this damage, begin declining by approximately 1 to 2% per year. By 70, that's a significant reduction in your internal defense capacity, which means the food environment you create for yourself matters more than ever. The dietary pattern with the strongest cancer protective evidence is the Mediterranean style of eating, not a diet, a pattern. Abundant olive oil, colorful vegetables, legumes, fish twice weekly, walnuts and almonds as primary snacks, and a dramatic reduction in red and processed meat. The synergy tip here is to always pair your vegetables with extra virgin olive oil. The oleocanthal in olive oil, a natural anti-inflammatory compound, has been shown to trigger cancer cell death in laboratory studies at Johns Hopkins University, and it dramatically increases the absorption of fat-soluble antioxidants from vegetables like lycopene from tomatoes and beta-carotene from carrots. I treated a patient named Gloria, 74, from Naples, Florida, who had been dealing with recurring precancerous polyps during her colonoscopies every 3 years without fail. We shifted her away from her predominantly processed food diet toward a Mediterranean pattern focused on daily olive oil, sardines, lentils, and colorful salads. Her next colonoscopy at age 77 was completely clear. She called my office in tears. That moment is why I do this work. And now, number one, the single most powerful daily cancer-preventing habit after 50, and the one that most seniors are doing completely wrong: daily movement. Not gym exercise, not marathons. Consistent, moderate intensity physical movement every single day, specifically 30 to 45 minutes of brisk walking. A study from the American Cancer Society tracking over 73,000 postmenopausal women found that walking just 7 hours per week reduced breast cancer risk by 14% compared to walking under 3 hours per week. Separate research published in the British Journal of Cancer found that regular, moderate activity reduced colon cancer risk by up to 24%. But here's the part most people are getting dangerously wrong. Exercising intensely 3 times a week and then sitting for 14 plus hours on the other days actually increases systemic inflammation and negates many of the benefits. Movement must be distributed throughout the day. Here's why this works so powerfully in aging bodies specifically. After 60, insulin resistance naturally increases, meaning your cells respond less efficiently to insulin, causing blood glucose to remain elevated longer after meals. Elevated blood glucose feeds cancer cells preferentially. Tumors have up to 10 times more insulin receptors than normal cells. Walking for just 10 minutes after each meal has been shown in research from George Washington University to reduce post-meal blood sugar spikes by up to 22%, more effectively than a single 30-minute walk done at another time of day. Movement also stimulates your lymphatic system, which has no pump of its own. It depends entirely on muscular contraction to move immune cells through your body. Think of your lymphatic system like a delivery network for your immune army. Every step you take is a contraction that pushes that immune army into circulation. After 75, your natural killer cell activity and the frontline immune cells that identify and destroy early cancer cells declines measurably. Daily walking has been shown to increase natural killer cell activity by up to 40% in older adults, according to research from Loma Linda University. The practical prescription is this: walk for 10 minutes after breakfast, 10 minutes after lunch, and 10 minutes after dinner. That's your 30 minutes, and you've distributed it perfectly to manage blood sugar all day. Wear comfortable shoes, walk outside when possible for the combined benefit of sunlight and fresh air, and pair this habit with number 3 on our list, morning sun exposure, by taking your first walk of the day outdoors before 10 a.m. Here's what I want you to hold on to as you finish watching this video today. You are not powerless against cancer. I have watched patients in their 70s and 80s transform their health outcomes through the consistent application of these habits. I've seen inflammation markers drop, immune function restore, and precancerous conditions reverse. It is never, and I mean never, too late to give your body what it needs to defend itself. Every morning you wake up is another opportunity to make choices that protect your cells, your independence, your ability to be present for the people you love. Quality of life at 75 and 85 and beyond is built one daily habit at a time, and you have far more influence over that future than anyone may have ever told you. If this video gave you something valuable today, please subscribe to this channel so you never miss our weekly research-based content made specifically for you. And I'd love to hear from you in the comments. Which of these 5 habits are you committing to starting this week? Tell me your age, tell me your habit, and I will personally read your response. I'll see you in the next video. Take care of yourself because you absolutely deserve it.